myself. My name is Dr. Abdul Gashi, working in a PG's hospital as a physician. I have been working since 20 years. I got MD, family medicine. So our today discussion will be about hypertension. So what will be the high blood pressure and how to prevent? We are going to deal with this topic. Generally, everyone would like to have healthy or normal blood pressure. But before going to high blood pressure, I want to tell what we mean by blood pressure. Normally, in healthy person, the heart pumps blood into the blood vessels. So it creates pressure against the walls of the blood vessel. This is called blood pressure. So normally the healthy person, if the falls throughout the day, but when the blood pressure remains high for a longer time and left untreated, it can lead to serious complications, cardiovascular accidents, like what we call there as stroke, heart attack, and everything. So persistent blood pressure higher than the normal blood pressure is called as hypertension. High blood pressure usually develops over a time. It can happen because of unhealthy lifestyle choices. Nowadays, we can see all are going for the bulky, like fast food, everything. So we are like what we call as stress and lifestyle modification. All will lead to high blood pressure. So the blood pressure can increases because of age. The people get elderly, the arteries can stiffen up and narrow, the excess fat buildup. And any family history of person, the one or persons have family history with hypertension, it increases the person's risk of developing a condition. And nowadays, we used to, as I told you, fast food, everything, excess of salt intakes is also known to raise blood pressure. And not eating enough foods with potassium can increase the blood pressure and the risk of stroke, and it will lead to what you call chronic kidney disease and everything. So nowadays, it's very difficult to survive the life. So maybe lack of sleep due to heavy workload and everything. The stress is the main problem for the. It will also increase the blood pressure. So hypertension, if you are telling hypertension, the hypertension does not have any obvious signs and symptoms. But that is why we used to call it's a silent killer. It like it put a like in our body, it has got several diseases. As I told you, cardiovascular, renal failure, stroke, and even we can like eye damage, blindness, everything we can. So earlierly, so what is the point of treatment of hypertension? How to treat the patient? When to start the hypertension? So the accurate diagnosis is very important in the management of hypertension. The measuring the how to diagnose. That is the only thing. The measurement of blood pressure is the only way to know the person with the high blood pressure. Because how to do this thing? So we are usually measured with an instrument called as a sigma manometer. So the blood pressure is recorded into two numbers, systolic and diastolic. Now let's understand the healthy normal pressure should lower than 120/80 millimeter of mercury, and it can also read as a 120/80 millimeter. We can see there's so many nowadays, so many electric instruments is there. So we only they are putting only 120/80 like that. So the upper number, that is called systolic blood pressure, which is the pressure in the blood vessel when the heart contracts. And the lower number indicates that is diastolic blood pressure. It is the pressure in the blood vessel when the heart rests when it's rests. So these are the two terminology we used to tell, systolic and diastolic. Whenever the patients go, oh, well, our blood pressure is normal, how much 20, 80. So they don't know what is the upper number, the below number. That is systolic and diastolic. As I told is, any symptom occur, that means like tiredness, headache, any vision impairment, or any nausea, vomiting, the person, those who have got the symptoms, you should check their blood pressure. So for blood pressure level is more than 140, when it is called high blood pressure, the normal value is 128. When it is called hypertension, that's more than 140, 80. That person have hypertension. If a person have BP levels higher than this, there is a risk of developing serious heart disease, stress, and everything. So nowadays we have got so many days, like our special Valentine Day, Mother's Day, Father's Day. So like that, there is a World Hypertension Day that is on May 17th. That is dedicated to this, dedicated to highlighting the importance of monitoring blood pressure and bringing the global awareness of the with high blood pressure worldwide. So the theme of this year, every year there was a theme is there. So in this year, the theme of this World Hypertension Day is measure your blood pressure, control it, live longer without any complication. So ensure the BP should be measured, controlled, and long live. That is the theme of this this year's World Hypertension Day. So the risk can be prevented and reduced by taking steps towards a healthier lifestyle. That is regular exercise. So we have got 24 hours per day. So we are 6 to 7 days we are going to sleep. And another rest of the time we are working for everything. So you just take half an hour for your life, like for your health, not life. So then your health will be good. Your what you call life will be smoother, and healthy diet. Please quit smoking and alcohol intake, and regular blood pressure monitoring, and stress management. Stress management, reduce the workload and keep calm and good sleep, and please be like a full time, like what we call smile. Then the stress will be fine. And if you're not controlled with any of them, you just go with the medicine. Okay. Then only first you control all this thing, and then only you can go to medicine. Okay. And then, but at last, I would like to suggest, there is nothing more precious than having a fit and a healthy life. So please check BP regularly when you have got any symptoms like what I told you about any heaviness of headache, vision impairment, and nausea, vomiting. So keeping blood pressure in the normal ranges is very important in preventing cardiovascular complication. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. So we hope we can control our BP, hypertension, and we can move a very good, healthy life. Thank you.